Carol, thanks for joining us. Can you share with us just how much different International Midwifery Day is this year amid the COVID-19 pandemic versus previous years?
Oh, well, usually we have some pretty big gatherings in government places, Ottawa, all the different capital cities across the provinces, and different countries, like all different countries do different things. But that's how different it is. We can't gather, but often we have some kind of social media experience across the country to help. We're pretty spread out. Midwifery is slowly returning back to our country, to the Turtle Island. It was well established at Contact, but now things are different.
Lots of things are certainly different. What have the past couple of months been like for Indigenous midwives?
Well, we've scrambled to figure out how to deliver our services safely to the people. We've talked a lot about how to keep our communities safe, particularly those communities that are in remote regions. We've talked a lot with government on how to keep people that are coming down for their deliveries safe, especially when they're going back.
Would you say there are enough midwives to meet the demand for services?
No, not at all. We were close to like a plane crash. It's my favorite saying, a plane crash away from extinction. Indigenous midwives were made illegal. Our business was co-opted by physicians and nurses, and we were removed systematically from our communities, which has really set back the health and well-being of Indigenous women quite a bit.
Can you give us an idea of how your industry is growing or how to grow it?
Oh, we've been growing leaps and bounds since we first got legislation 20 years ago, but not nearly catching up enough across the country. When different provinces get legislation for midwifery, and we're just now beginning to have all provinces and territories have midwives legal in Canada, then when that legalization happens, Indigenous midwifery seems to follow with the government decision to do that.
Well, Carol, thanks to you and your colleagues, and thanks for being with us here today.
Thank you so much, Miigwech.